Welcome back to the channel, everyone. I'm your host, Kevin Glotra. This is episode 1, Your Fellow Cardiologist. First and foremost, I just want to thank everyone who shared, viewed, and liked episode 0, which was uploaded last week. If you haven't already done so, please don't forget to subscribe to the channel and be sure to share this week's episode on your social media. I hope you enjoyed the introductory podcast and got a feel for what this series will be about. It's now time to get started with the official first episode. So today I'll be interviewing Dr. Kumar, who is a cardiology fellow currently working in Albany, New York. Together we'll be discussing the field of cardiology as a subspecialty in medicine, the hard work required to become successful in this career path, as well as some of the rewarding and difficult aspects that come with practicing cardiology. If you're a medical student interested in doing cardiology as a subspecialty, or any other student who is considering pursuing medicine as a career path, I hope you'll find this interview really helpful for your future career decisions. And even if you're not one of those people, I found this interview to still be very informative about what it is specifically that cardiologists do, and I think you'll genuinely find that the research, the science, and the pathology present behind this field is quite interesting. Secondly, you might have noticed that I actually recorded a video this time through Zoom, despite saying earlier that I would do a podcast series. I've actually made the decision to turn this YouTube channel into one that disperses both podcast episodes with audio only, where I'll be discussing important topics important to my channel, along with interview video episodes where, like I said earlier, I'd be working with working professionals like I have for today's episode. So without further ado, let's meet Dr. Kumar, our fellow cardiologist. All right. Hello, Dr. Kumar. Welcome to the show, and thanks so much for being here.
Thank you for having me, Kevin.
All right, awesome. So this is the first episode of this series where we're interviewing working professionals to get a better idea of what different career paths are like. Mm-hmm. So to start us off, this is sort of the first question. Can you just sort of start us off with what the basics are about your profession as a cardiologist, and just tell us a little bit about what a cardiologist does?
Okay, so I'm a cardiology fellow. I finished a residency in internal medicine. Then I chose to do a further subspecialty in cardiology. The residency was 3 years after 4 years of medical school. So I finished 3 years of internal medicine residency in Philadelphia in 2018, June. Right after that, I started my cardiology fellowship in Albany, New York, which is a state capital of New York, for another 3 years. So I'm in the second year of a 3-year fellowship here. Nice. And after I finish, I'll be a general cardiologist, able to practice on my own. Since I'm a fellow, I have to manage patients, take care of patients in a supervised setting.
Okay, awesome. So can you tell us a little bit about some of the typical cases you might see on a day-to-day basis and various clinical conditions that come about in the field of cardiology?
So cardiology, it's kind of a broad field related to heart, cardiovascular, meaning the blood vessels and stuff. We manage blood pressure. We manage heart attacks, arrhythmias, meaning irregular heart rates, valvular disease. Sometimes valve disease involves narrow or leaky valves. We help fix them or manage them. And one of the other big points we manage is heart failure. This basically refers to where the body or the heart specifically can't meet the metabolic demands of the body, can't keep up with what the body actually needs.
Okay, awesome. Thanks. So I was going to ask you this question after you sort of already touched on it. I was going to ask about the educational requirements needed to become a cardiologist. So you already answered that with the internal medicine and the residency. So I was just going to ask a follow-up question to that. Of these individual parts of your journey to become a cardiology fellow, which of these aspects or which of these parts of the journey was the most difficult and why?
Definitely, I'd say the med school part was the most difficult.
Sure.
I did go to medical school in a foreign country. So first going to the foreign country, not knowing anybody there, and then having able to study 12 to 14 hours a day, it was definitely tough. But once got off the island, I went to Ross University in Dominica in the West Indies. Got off the island and I traveled around the country during my clinical rotations, getting hands-on experience. So that was better because at least I could come see my family at the end of the day. And residency was much better because think of it as a job, not like a typical job where it's 9 to 5, but you do think of it as a job and then come home at the end of the day, unwind. So the toughest part was definitely med school out of all this. Yeah,
the high volume of studying hours for sure.
High volume of studying, and again, just sheer amount of stress too.
Yeah, sure. Okay, so the next question I wanted to ask, and this is something I'll probably get asked in a future medical school interview, but I think it's an important question. I think it's probably one of the most important questions
Mhm.
comes about in med school interviews. So I wanted to ask you this question as well. What made you want to pursue the field of medicine? And after that specifically, what made you want to pursue the field of cardiology as a
Okay.
subspecialty?
It's a good question. So, um, you definitely will get asked this on your medical school interviews. So, it's a very broad question. It's kind
Definitely.
of whoever you ask, people will say, "Oh, I want to help people," or "My dad was a doctor. I always looked up to him. I never had anybody in the family who was a doctor before me." What I did like is I like the science behind it, the amount of research that goes into medicine, and then applying that research that you've done and helping manage extremely sick people definitely attract me to this field.
For sure.
Yeah.
And then for cardiology specifically, as a subspecialty,
So
was there?
cardiology, again, the amount of research that goes into cardiology, there's at any given point, there's tons of trials going on in this field, whether it be management of heart attacks or newer therapies that come out.
Yeah.
The thing that I liked about cardiology, it involves diagnostic medicine and also interventional medicine, where a patient comes in with an acute heart attack and you have a limited amount of time to open up that blood vessel that was blocked that's causing the heart attack. So it combined practical skills as well as diagnostic skills is what attracted me to it.
Yeah. Yeah, that sounds really interesting. So you commented on the research, and I wanted to sort of ask a follow-up question to that.
Uh-huh.
As you know, like medicine is a very changing field. Like every day there's like a new study that comes out that's changing the therapies and everything that are going on in the field. So
Okay.
in terms of being a cardiology fellow and just like even when you go into practice later on,
Yeah.
how do you sort of go about managing the constantly updating research and incorporating that into your practice? Because medicine is just such a thing that just continuously changes.
So, any point in medicine, there's control boards like American Board of Internal Medicine, or in this case, American College of Cardiology. They put forth guidelines, and all these guidelines come from the research that does take place. And what they do is all these trials that take place, they actually print them out, send out emails, send out magazines that are printed weekly or even monthly, and which explains how he did the trial, how this drug was better than the drug that came before, or this drug causes these side effects. So it's good to read up on these magazines at least whenever they come out, just to keep up on the research. Say how this new drug came out. How can I apply this to my practice, and how will it benefit my patients?
Mhm.
I take care of this specific type of patient versus the study was looking at this particular type of patient, patient A versus patient B. How can I apply this to my patient when in turn this drug actually was beneficial in this type of patient? So um, medicine is a never, like you said, it's ever evolving, but you have to keep up. Spend time out 15, 20 minutes every night, read an article. I think you'll be fine if you do that every day.
For sure. Yeah. Okay.
Yeah.
Awesome. All right. So that sort of touches on like the whole medical school and like why you chose to do that. That's awesome. So in terms of like now that you're a cardiology fellow, obviously you're heavily involved in the hospital and wherever you're practicing.
Okay.
In terms of what you do on a day-to-day basis, what do you find to be the most rewarding aspect of being a cardiologist or a cardiology fellow now that you've reached this point?
Yeah. So I'm specifically interested in interventional cardiology. That's actually an extra year after general cardiology, which I'll be completing from 2021 to 2022. Um, the thing I like about this field is most reporting, a patient comes in, pretty typical heart attack symptoms. All their labs point to that, their EKGs point to that, and they're having crushing chest pain.
Mhm.
You take them upstairs to the lab, rush them up, open up that blood vessel, and you see almost instantaneous results.
Mhm.
Very few fields in medicine,
Mhm.
specifically, where you see this quick of a result right in front of your eyes.
Mhm. For sure.
Yeah,
Yeah, especially with
probably
fields.
one of the most rewarding parts of the day.
Yeah, definitely. Like especially with fields like oncology, where you're treating cancer patients. Like
Mhm.
those patients tend to have much more like when you're treating them, it takes much longer to actually see results. But with cardiology, it's like you do
Yeah,
you do the intervention and
and you got to think of it like cardiovascular disease is, even though our research behind our therapies behind it have grown immensely over the last years to decades, it's still the number one killer of people, older people, especially,
Mhm.
at least in the US, even worldwide. So,
Yeah, yeah, for sure. So Yeah, so I guess that's one of the more rewarding aspects of the field for sure. In terms of like what a typical day would look like for a cardiology fellow, can you highlight one like what a typical day would be like, as well as things like the patients you see, other healthcare professionals you have to
But
work with?
it depends on what rotation I'm on. Again, since I'm in a training setting, we rotate through multiple different parts of the hospital.
Mhm.
Let's say I'm currently on an echocardiogram rotation. We sit and read studies looking at the function of the heart, how well this heart is beating compared to a normal heart, or if this valve is leaky or not. If I was in the cath lab, I'll be doing procedures looking at blood vessels inside the heart or valvular disease, looking at hemodynamics, meaning, um, again, how tight this lesion is inside the heart.
Mhm.
If I was on the general floor consults, that's usually going around seeing patients. Let's say there's a team that needs help in management of this irregular heart rhythm, they'll call us in giving guidance on how to manage that.
Okay.
So I usually get into the hospital around 7 a.m.
Yeah.
For the most part, day ends around 5 p.m.
Mhm.
But if I'm not on call, and our calls are 24 hours, meaning you stay awake for 24 hours for the most part.
Yeah.
So if I'm not on call, I'll come home. If I am on call, then usually stay in the hospital.
Yeah.
If call does begin to get slower later on in the night, I do come home and answer some phone calls from home. And
Okay.
if I need to go back, and I will go back.
Yeah. And once again, that would like change depending on the rotation, like you said, right?
Yeah.
Awesome. Cool. So another thing I want just to follow up to that. So obviously people like they tend to see that when you're in residency, there's typically like a higher volume of work hours because you're in training, and at the same time you're also practicing and you're treating patients.
Yeah.
So in terms of the transition, obviously now that you're a fellow, going from a residency in internal medicine to now being a cardiology fellow, to in the future you're going to be hoping to practice as a cardiologist, of course. How do you think the overall schedule changes as you go from training to a
So
or clinical setting?
the amount of supervision goes down,
Mhm.
responsibility goes up, because as you progress through your training,
Mhm.
you expect your training does go, your responsibility taking care of the patient does go up.
Yeah.
Now, work hours, it depends on what field you're in.
Mhm.
But let's say, as a attending compared to a resident, I will have to stay in the hospital all the time, because then I'll have residents myself later on who are in training themselves, and they'll call me for whatever question they have.
Mhm.
So actual work hours being in the hospital will go down,
Mhm.
but the amount of responsibility goes way up.
Definitely way up for sure. Yeah. So we talked a little bit about some of the really rewarding aspects of your job. We're sort of
Mhm.
at the other end of the spectrum now. What do you feel is the most difficult aspect of your job as a cardiologist?
Uh, so sometimes it's talking to a family, meaning,
Mm.
let's say this patient has a terminal condition where, hey, it's gotten too far. You don't think they're not gonna get better, but you have to talk to the family, and they have sometimes a tough understanding. Hey, why don't you just do this? Why don't you do this?
Yeah.
Because you got to think of it. You're we're playing a line between causing benefit to a patient and where you can cause harm.
Mhm.
So sometimes holding a therapy is more beneficial than actually giving it, because it actually cause harm to a patient. And
Yeah.
talking to the family, helping them understand sometimes is the toughest part of our job, I'd say.
Yeah, for sure. Yeah, that's definitely a difficult aspect, and many subspecialties.
Managing the family's expectations
Yeah.
is definitely
Mhm.
a tough part at times.
Yeah, for sure. So yeah, we sort of touched on this earlier as well with like cardiology and oncology, how like we have sometimes immediate effects versus, and other times we'll have like a much longer treatment pattern. So I wanted to highlight I wanted to ask you, like, would you be able to highlight how cardiology sort of differs from other medical subspecialties, like overall in general? It doesn't have to compare to like different fields, but all in general.
Well, it's how I'd say this is because you're so subspecialized that you just deal with a specific condition. Like I would not manage any type of cancer at all,
Mhm.
even though our fields overlap to some extent, because some of the drugs they give can cause harm to the heart.
Mhm.
But we talks amongst each other to make sure, hey, is this the right therapy for this patient? Will you giving this drug, will this do this to the heart, or will me giving this drug cause bleeding here? So yes, I am much more subspecialized, but it's not like we don't necessarily not talk to other fields as well.
Yeah.
If I decided to stick in general medicine, those are the doctors who manage a broad variety of disease, and once something gets a little complex, they might call the consultant and ask for help.
Mm-hmm.
So as a subspecialist, we're sheltered to some extent of what exactly we manage.
For sure, yeah. And that's like the whole point of subspecializing. You deal with a certain aspect, for sure. All right. This one's a bit of a tricky question. So what do you feel is one of the biggest misconceptions behind the field of cardiology overall, like amongst the medical community in general?
Amongst the medical community or the general community?
Let's go with the medical community first. So like medical students, other healthcare professionals.
So I think misconception about cardiologists is a lot of them, from what I've seen, me talking to cardiologists personally when I was a medical student or a resident myself versus now, misconception that they're very impatient. I wouldn't say that's the case, because they just ask questions to guide ask questions to extract what specific information they need. They don't need information regarding whatever the patient's breathing status or something else, or the blood sugar. Hey, I need to know what the blood pressure is. I need to know what the heart rate is. I need to know what the EKG says. That's what's going to help me in my thought process in managing the patient, not some other extra information.
Yeah.
So yeah, it's kind of it is a tricky question. So it's kind of hard to answer because a lot of stuff interacts so well amongst the field. Mm-hmm. But a lot of times I have heard that other people think a lot of cardiologists are impatient. Yeah.
Yeah. There's always like stereotypes with any given field for sure. But yeah. So this one is sort of also once again talking about your journey to like get to this point again. So most people will know that medicine is a high volume of studying hours, clinical hours. It's just in general, it's a very big commitment overall towards your overall life.
Yes.
So in terms of finding a work-life balance in medical school residency and now in your fellowship, how did you sort of go about doing that, being able to just manage everything?
So I think when you're first thrown into it, it's kind of hard to get a good balance between work and life. But as you progress in your training, you learn to manage it much better. Hey, I need to devote this much time to studying. I'm working from this time to this time. That means after coming home, I need to devote this much time to going to the gym, working out. And then after I work out, I need to finish this presentation. You learn how to manage it. I'd say it's a trial and error, because sometimes I still am fine tuning it, but as you come along, I think you'll get much better at it. Yeah. It's definitely trial and error.
Mm-hmm. And it's important too, right? Like it's something you definitely need to have.
You can't be studying 24/7, otherwise you burn yourself out.
Yeah, for sure. All right. One last question I have for you. So once again, this channel is for high school students, undergraduate students, and like students in professional schools who are trying to figure out what career they want to go down. So now, as a successful cardiology fellow yourself, what advice would you give to a medical student or even a really eager pre-medical student who is considering cardiology as a career choice?
So the advice, I'm going to be very realistic. It's a very long road. It's something we call delayed gratification, meaning a lot of times you'll see friends who didn't go into medicine go out and party, go out and travel, which you're stuck at home studying, writing papers, stuff like that. A lot of delayed gratification. You got to have the motivation to do it, because you'll do 4 years of undergrad, 4 years of med school, in my case, 3 years of residency, now 3 years of general cardiology, then 1 year of interventional cardiology. Mm-hmm. So it's a long road. It's going to be delayed gratification. There's going to be times where you think, hey, what am I doing? But as long as you're motivated, I think you'll do fine. Mm-hmm. And there'll be times where you're living away from family. You'll miss out on birthday parties, weddings, stuff like that. Mm-hmm. But just think of it. It's to a better. You're getting close to the finish line. You'll think back at it at the end and be like, hey, I went through the struggle, but it all paid off at the end.
Yeah. All right. Awesome, for sure. All right, so that pretty much concludes our interview. Thank you once again, Dr. Kumar, for being on the channel. Once again, this is the first episode of our series, so I really appreciate it. Is there any last words you have to give? Or?
No, I think that sums it up. Thank you for having me.
Yeah, awesome. Okay.